For the second time in a week, Democratic lawmakers are blaring an alarm over how a federal law delivers massive cuts to Medicaid and SNAP. The state projects a $2 to $6 billion a year loss in revenue. Today, Governor Spanberger signed an executive order directing the Office of the Secretary of Health and Human Resources to protect health care coverage and food assistance for Virginians.
It was passed as a cost savings mechanism.
Governor Abigail Spanberger turns up the volume on her criticism over federal cuts to Medicaid and SNAP.
The cuts in health care coverage to people, the cuts in dollars to hospitals, the cuts in dollars to help put food on the table for hungry children, that is the way they achieved cost savings so that they could give tax cuts, loss of revenue, to the wealthiest Americans.
The cutbacks come in the president's bill, H.R. 1. He calls the One Big Beautiful Bill.
Nearly 300,000 Virginians are at risk of losing Medicaid coverage.
Because now Medicaid expansion adults will have to undergo eligibility requirements every 6 months instead of every year. Retroactive eligibility is reduced, and there are new work requirements.
These individuals are already working. What we know is that this will be additional paperwork that these individuals now have to demonstrate to be able to keep their coverage, or else they risk losing it.
The bill narrows eligibility for certain lawfully present immigrants. Included is the elimination of the provider tax that has some hospitals barely able to keep their doors open, or they must cut services.
If you're looking to recruit business investment to parts of Virginia, one of the principal questions is going to be, can you provide basic health care?
And when it comes to SNAP, the state will have to pick up 75% of the cost instead of 50%.
That cost will pivot over to communities, to food banks. It means there will be kids in schools who are hungry, or the impact is significant.
And Spanberger says her administration has already invested about $500 million to help Virginians access affordable health care services. Most of the new Medicaid provisions take effect at the beginning of next year.